In this episode of the Huberman Lab podcast, Andrew Huberman and Dr. Peter Attia examine a paper that investigates the effects of light exposure on mental health. The study, involving over 85,000 participants, underscores the independent and additive effects of light and dark exposure on mental health symptoms across various disorders. Andrew Huberman presents the biological mechanisms behind the impact of light on mental health, explaining how specific cells in the neural retina respond to different types of light input. These cells send signals to the hypothalamus, which in turn regulates the circadian clock and mood. The study emphasizes the importance of bright light exposure during the day and darkness at night for optimal mental health. The significance of low solar angle sunlight in the morning and evening is discussed, as well as the role of bright light exposure throughout the day. The impact of dark exposure at night is also considered, with the potential benefits of seeking light and darkness as non-pharmacologic means for improving mental health being a focal point. The study's findings suggest that seeking light and darkness may be a simple and effective way to improve mental health. The practical implications of these findings for everyday life are explored, with Andrew explaining the importance of morning and daytime light exposure in relation to mental health and the symptoms of various mental health disorders. Dr. Peter Attia presents a paper that explores novel treatments for cancer, focusing on the role of the immune system in cancer treatments. The paper discusses current and future technologies for cancer treatments, highlighting the key role of the immune system and autoimmune system in the treatment of cancer. The discussion delves into the complex landscape of cancer treatments, including the impact of immune modulation and the potential for personalized cancer therapies. Dr. Attia emphasizes the importance of understanding the immune system's role in cancer treatments and the potential for innovative approaches to cancer therapy. The paper provides valuable insights into the evolving field of cancer treatments and the potential for leveraging the immune system to develop more effective and targeted therapies for cancer. The study used 3 models to examine the association between light exposure and psychiatric outcomes. The first model looked at the unadjusted association, the second adjusted for age, sex, ethnicity, and photoperiod, and the third adjusted for employment and physical activity. Surprisingly, the results from all 3 models were very similar, indicating that the outcomes were consistent across the different models. This suggests that the variables had less dependency on the outcomes than expected. Increasing nighttime light exposure was associated with a higher probability of major depressive disorder, generalized anxiety, bipolar disorder, PTSD, self-harm, and psychotic symptoms. Conversely, increasing daytime light exposure was associated with a lower probability of these mental health issues. The relationship between light exposure and major depressive disorder was particularly strong, with a dose-response effect observed as nighttime light exposure increased. The study also highlighted the importance of darkness at night as a treatment for bipolar disorder, as well as the negative impact of bright nighttime light exposure on mental health. The study also discusses the impact of medication on light sensitivity. Certain medications used to treat bipolar disorder reduce the sensitivity of the light-sensing circadian system, potentially contributing to their effectiveness in managing symptoms. Similarly, some antidepressants may suppress the ability for daytime light to positively impact mood systems. This suggests that medication can influence an individual's sensitivity to light, which in turn affects their mental health. Dr. Attia and Dr. Huberman emphasize the importance of considering the context in which light exposure occurs. They discuss how the stimulation from activities on electronic devices at night may have a greater impact on mental health than the brightness of the light itself. They also highlight the need for individuals to be mindful of their overall lifestyle and stress levels, as these factors can interact with light exposure to influence mental well-being. The podcast also touches on the impact of light exposure on sleep. It is mentioned that waking up in the middle of the night and looking at the time can be disruptive to sleep, and that sleep trackers may influence an individual's perception of their sleep quality. The discussion emphasizes the need to minimize light exposure at night and to consider the broader context of an individual's activities and stress levels in relation to light exposure. Dr. Attia and Andrew Huberman emphasize the significance of light exposure in regulating circadian rhythms and its impact on mental health. They discuss the profound effects of light on mood regulation and the importance of maintaining a natural daylight-night dark rhythm. They highlight the role of light in influencing cortisol levels and its impact on sleep patterns. The conversation underscores the need for individuals to prioritize exposure to natural light during the day and minimize nighttime light exposure to support overall mental well-being. The discussion shifts to the immune system's role in recognizing and responding to antigens, particularly in the context of cancer therapy. Dr. Attia and Andrew Huberman explain the mechanisms by which T cells recognize antigens and mount an immune response. They highlight the adaptive nature of the immune system and its ability to combat viral infections. The conversation delves into the significance of MHC class I and class II receptors in presenting antigens to T cells, leading to the activation of the immune response. The conversation delves into the impact of antigen recognition on cancer therapy, particularly in the context of immunotherapy. Dr. Attia and Andrew Huberman discuss the landmark study in a class of drugs that have shown promise in cancer therapy. They emphasize the adaptive nature of the immune system and its potential to recognize and target cancer cells. The conversation underscores the potential of immunotherapy in leveraging the immune system's ability to combat cancer and reduce mortality rates. Dr. Attia and Andrew Huberman explore the complex interplay between light exposure, immune response, and mental health. They emphasize the need for individuals to prioritize light exposure to support circadian rhythms and overall well-being. The conversation highlights the potential of immunotherapy in leveraging the immune system's adaptive nature to target cancer cells. They underscore the importance of understanding the mechanisms by which the immune system recognizes and responds to antigens, particularly in the context of cancer therapy. Dr. Attia explains that the immune system plays a crucial role in fighting off viruses and other pathogens. He describes how antibodies work to bind to viruses and destroy them, and how the body's immune response can vary depending on the type of virus. He also discusses the concept of thymic selection, which occurs in infancy and teaches T cells to recognize self and not attack the body's own cells. Cancer, on the other hand, is a genetic disease characterized by mutations in cells. Dr. Attia explains that most solid organ tumors have antigens that are recognized by the host's immune system, but the immune response is often insufficient to induce remission. He highlights the ability of cancer cells to evade the immune system through various mechanisms, such as secreting factors that inhibit immune response and leveraging glycolysis to lower the surrounding pH and detract the immune system. The conversation then shifts to the concept of immunotherapy and the use of checkpoint inhibitors to unleash the immune system's response to cancer. Dr. Attia explains that checkpoint inhibitors, such as anti-CTLA-4 and anti-PD-1 drugs, work by blocking the inhibitory signals that prevent T cells from attacking cancer cells. He discusses the rationale behind using these drugs and the potential for novel discoveries in cancer treatment. Dr. Attia focuses on a specific study that compares the efficacy of an anti-CTLA-4 drug with a placebo in patients with metastatic melanoma. The study includes patients who have progressed through standard therapy and have limited treatment options. The primary endpoint of the study is overall survival, and the researchers use Kaplan-Meier survival curves to analyze the data. The results of the study show a clear distinction between the placebo group and the two treatment groups. The Kaplan-Meier curves demonstrate a significant improvement in overall survival for patients receiving the anti-CTLA-4 drug, both alone and in combination with the GP100 vaccine. The median survival rate for the placebo group is low, with only one patient surviving at 44 months. In contrast, the treatment groups show a higher overall survival rate, indicating the potential efficacy of immunotherapy in treating metastatic melanoma. Dr. Attia and Andrew Huberman conclude the discussion by emphasizing the importance of immunotherapy in cancer treatment and the potential for further advancements in the field. They highlight the significance of the study's findings and the implications for patients with advanced cancer. The conversation provides valuable insights into the complexities of the immune system, the mechanisms of cancer, and the promising role of immunotherapy in improving patient outcomes.